So hello and welcome to this, the 12th panel in our roadmap series, Discussions for the Future of Poultry, People and Planet. These fortnightly discussions address key issues for sustainable development from the perspective of nutrition security and the global poultry industry. And today we're returning to our theme of disease governance to explore how an intersectoral approach to biosecurity can contribute to better health and better economies. A few housekeeping notes. Today's discussion will last for 1 hour. The event is being recorded and the recording will be available on the One Health Poultry website in a couple of days' time. Please do put your questions to the panel through the Zoom Q&A function, which you can access at the bottom of your screen. Feel free to vote for the questions that you think are particularly important. And if English is not your first language, please don't let this stop you from asking questions. I will put as many of your questions as possible to our panelists. If your question is covered in a previous answer or we run out of time, please do accept my apologies. We have an online discussion channel that you can access from the website and from your registration link. Please do explore this channel to share questions, comments, thoughts, etc. The online discussions will contribute to a series of briefing notes that we are preparing from the series. So first, we'd like to welcome your thoughts via the first poll, which should be coming onto your screens now. So once you've voted, the poll will disappear from your screen. And we'll come back to review this a little later. So I'm delighted today to welcome our expert panelists. We have Professor Mark Schipp, the Australian Chief Veterinary Officer, and Professor Christine Middlemiss, the UK Chief Veterinary Officer. Thank you very much for joining us. We know how busy you are and we really appreciate having both of you here to share your thoughts on this really important issue, and it'll be very interesting to see how it goes. So each of you has got 10 minutes and we'll give you a signal at 9 minutes so that you can then wrap up. So with no further ado, over to you, Mark, for the first presentation.
Thank you very much. It's a great pleasure to have this opportunity to speak to you and particularly to share the stage with my colleague Christine Middlemiss. And as I'm sure Christine and many of the audience will agree, One Health is a particularly important topic, and the juncture between biosecurity governance and One Health is one that is important at the international, national and local levels. So I'll start by looking at the international and national issues, and hope that Christine can take it further from there. And I can't get my slide. There we are, to advance. So the concept of One Health is not particularly new, but to reinforce that, it's the collaborative efforts of multiple disciplines working locally, nationally, globally to attain optimal health for people, animals, and our environment. And it's, as I said, it's not a new concept, but it's one that's become more greatly and widely used since the early 2000s. Biosecurity is a fundamental One Health issue. At its core, biosecurity is about managing risk, and the World Organization for Animal Health, the OIE, defines biosecurity as a set of management and physical measures designed to reduce the risk of introduction, establishment and spread of animal diseases, infections or infestations to or from and within an animal population. And we know that some animal diseases have direct and indirect human health consequences. For example, zoonotic diseases like influenza viruses, or and some also impact on food security and prosperity. We also know that some disease events have significant impacts on economy and prosperity, and including through productivity losses and trade impacts. So we need to go beyond considering the consequences to animal and human health to include welfare, prosperity, and the direct and indirect impacts of animal health that can occur on the environment. And conversely, we cannot forget the direct and indirect impacts of human and environmental health issues on animal health and welfare. We know that a health impact on a farmer will impact on the health of their animals, and likewise an environmental health issue will have impacts on both the farmer and their livestock. So by adopting a One Health approach, biosecurity risk can be more effectively managed, and a comprehensive approach can be taken. Managing threats and optimizing health will only become more important. This is because the world is under increasing pressure. There is more and more biosecurity risks, which are constantly evolving and changing, driven largely by human behaviour. And as these threats continue to escalate in both scale and frequency, the urgency of adopting a One Health approach, at least to keep pace, is only becoming more critical. COVID-19, the pandemic, has given us an insight into a One Health approach, with the media understanding and picking up on the issue that this is a spillover event from wildlife that was driven by changes in the environment. However, implementation of a One Health approach is often lacking. And without genuine One Health activities to effectively understand and address human, animal, and environmental health threats, we risk being overwhelmed trying to unsuccessfully manage and respond to events rather than prevent them from occurring in the first place. And we need good governance. Biosecurity is a legal issue, and for good reason. It must be underpinned by robust governance, legislation, policies, and other arrangements to ensure that biosecurity measures take effect and operate as they're intended. If we look at the global level, there's international governance through the WHO, OIE, and FAO, and that tripartite had recently brought in the United Nations Environment Programme, and the inclusion of UNEP to form a tripartite plus is very welcome and recognises the importance of the environment and its health. The tripartite has led efforts to promote cross-sectoral collaboration, addressing zoonotic risks and other public health threats. And a number of support tools and products have come out of that. The tripartite zoonoses guide, the OIE's performance of veterinary services, the PVS tool, which evaluates the performance of veterinary services. The WHO has got a joint external evaluation framework, which again evaluates the performance of human health services, and associated bridging workshops with participation from human and animal health sectors, which the tripartite and its members are holding on a regular basis. So One Health at the national level, it was recognised in 2014 through the OIE-WH operational framework that for good governance at the human and animal health interface, it's a shared responsibility. And that framework recognises that governance as a human and animal health systems which comply with international regulations. So applying those WHO international health regulations, the OIE veterinary standards regulations is a necessary global governance measure. But those measures and that understanding could be extended further to include the environment and non-livestock animals such as wildlife. Here in Australia, agricultural biosecurity is built on the understanding that it's a shared responsibility. The government at the national level plays its role at the border, industry play their role behind the border and on farm, states play their role in responding to incursions, but industry also play a role in ensuring that they comply with regulations and that they report incursions should they occur. And then there's a raft of formal and informal mechanisms that support the One Health collaboration. So we have a communicable diseases network, and the veterinary services contribute to the human health discussions there. We invite our human health colleagues to contribute to and comment upon risk assessments that we're undertaking in the animal biosecurity sector. My role as Chief Veterinary Officer is complemented by a Chief Plant Protection Officer, and recently we've created a Chief Environmental Biosecurity Officer. So the three chiefs work together, and we collaborate obviously with the Chief Medical Officer. And a good example of that is in the case of antimicrobial resistance, where together with the Chief Medical Officer, I have stood up the national strategy, and that's reflected at the global level through the mandate that was delivered by WHO for nations to have a response strategy to AMR, and then the implementation of that in a One Health sense by OIE, FAO, Codex, and other groupings. And we've seen a number of other groupings emerge recently. One of those is the One Health Global Leaders Group on antimicrobial resistance, and a number of ministers and social and political leaders are contributing to that. In the case of Australia, our Environment Minister, Minister Susan Lee, is a strong advocate for action to combat the threat of antimicrobial resistance. And it's pleasing that she's a member of that group. So to turn to the future, the challenges that we face are immense, and they require comprehensive solutions. And the only way we're going to be able to develop comprehensive solutions is if we take a One Health approach. And those challenges are antimicrobial resistance, pandemics, food insecurity, environmental emergencies, and a raft of other issues that are yet to emerge. The only solution is one that brings together all of the relevant sectors and disciplines, including health and environment professionals, sociologists and economists. We can't consider solutions to the challenges that we face unless we also recognise that these are human issues. For example, African swine fever is not being spread by pigs, but by people and people moving pigs and pig products. And so understanding that sociological context is important, as is understanding the economic context and the economic impacts. All of this needs to be bound together in a One Health framework, and therefore siloed approaches will not deliver the changes that we need. And biosecurity at the farm or the clinic level, at the national level, is a critical contributor. And that's why the development of standards through the intergovernmental bodies such as OIE and Codex are so important. They not only support trade, but they underpin and support enhanced biosecurity. And that's for the benefit of all, not only for human health and animal health, but also our environment and our wildlife. And to keep the momentum going, we all depend on this collaborative framework. Thank you very much.
Thank you very much, Mark. That was a great start to today's panel. So to our audience, if Mark's talk has stimulated your thinking, do please put your questions up into the Q&A box, and I can see we have some coming in already. But first, I'm going to turn to our poll. I think the results are in for the first poll. Someone can put them up. There we are. And I guess maybe not a surprise with this audience, but very, very interesting that 78% of you think that all of the above are urgent priorities. So you're putting the integration of all of these different activities across animal health, environmental health, public health, and the engagement of ministries in risk assessment and governance as having equal weight. So that's really interesting, and thank you very much for that. I'm now going to turn to you, Christine, and call on you to deliver your talk. Thank you very much.
Thank you very much, Fiona, and good morning, good afternoon and good evening to everybody who's joined us today. I'm very pleased to be able to take part in this conversation and pleased to follow Dr. Mark Schipp from Australia to give my perspective and a UK perspective on biosecurity governance in the One Health space. And I'm interested too in the poll result there on integration, because that's something in the last 18 months that has been very much in my head. And we'll touch on it as we go through this presentation. If we can move to the next slide, please, Dan. Thank you. So as Mark said, One Health is not new. The term is more modern, but the interaction of wildlife, domestic animals and humans, and the disease challenges associated with that have been around for a very long time, and we're very familiar with them. Tuberculosis, for example, in many developed countries, we control that through pasteurization, but we still have an issue, and an issue here in some parts of the UK, of tuberculosis in cattle linked to an endemic disease situation in wildlife. And rabies would be another example of that. And so economic and health impacts, even at that level. But as Mark said, the increasing human population globally, more interaction and changes in land use, more interaction with wildlife, changes in how we keep our domestic animal population, all gives rise to the potential for new risk pathways for new and emerging diseases, or the diseases that we know well to behave in different ways. And I just wanted to touch on some recent UK examples that highlighted to me the importance of biosecurity in that interface. Now, these haven't been necessarily big or significant outbreaks, but they have had an impact for the humans involved and potentially for those businesses. And one of them we've seen increasingly is the trend and popularity of feeding raw pet food to pets, rather than the sort of whole diets that you can purchase. And people are sourcing these often not through the usual pet food supply route with its various biosecurity controls, but seeking different routes to buy pet food. And what we found is that sometimes the handler gets sick. They haven't appreciated that they're sourcing perhaps through a non-managed biosecurity route, and they haven't appreciated the need to take precautions when they're handling that food and giving it to their pets. And feeder mice for snakes, for example, with salmonella is another good example of that. Petting zoos and farms, very popular, particularly as lockdown is easing in the UK and people are getting out and about again. Some very preventable cases every year pop up of those well-known Campylobacter, E. coli and salmonella in the visiting children. Again, very simple, no regrets measures can be taken to prevent these diseases spreading into people. We in the UK have identified SARS-CoV-2 and I confirmed it in one cat. That cat indeed did come from a SARS-CoV-2 infected household. We've also been looking at the potential role of vermin. Is there a role for vermin in the spread of the virus between people and the environment, recognising vermin in sewers, infected virus in sewers? The conclusion from our risk assessment was that this was very low risk, but it was something that was worth looking at. And finally, over this winter, we've experienced one of our biggest avian influenza outbreaks ever. And as always with these sorts of things, although predominantly our outbreak has, like the rest of Europe, been an H5N8 outbreak, every infected premise is different because people manage their animals in a different way and they interact with them in a different way. And so we've had to adapt our approaches to deal with that, managing the impact of onward spread from an infected premise while managing the economic impact on that unit. And potentially where we had a conservation site infected, their absolutely excellent biosecurity with insight enabled us to take some very restricted approaches to managing and identifying where infection was and preventing the onward spread of it through a combination of those well-established practices of isolation, testing, surveillance, and so on. And the second one I wanted to raise with people in that context was we had an interesting detection in a captive seal on a wildlife unit that rehabilitates animals, where there was a pathway developed for exposure actually around bathing of seals between wild birds and people who had been working with wild birds and the seals. And indeed we detected the virus in those seals. It hadn't spread further on. So a lesson there for all of us that even in small ways, in relatively routine disease control and interaction events, there novel things happen. Next slide, please. So people will be familiar, I'm sure you may use different terminology, but the biosecurity toolkit, the need to invest in prevention and biosecurity and preparation pays back huge dividends compared to having to invest in respond and recover. And this is true both at individual animal level, farm level, consignment level, or at country level, and indeed globally, as we've seen with the COVID pandemic. And there's a number of things that are common across all these levels, and Mark has touched on them. Ongoing investment in science, so that we have the latest technology to use. Surveillance, whether it's checking that individual animal or your flock daily to look for changes, or national level surveillance to look at changes across your national level population. Legislation is a really important, although cumbersome tool. We know that if we want to achieve freedom and eradication from disease, we need all actors, all keepers to be taking action, to have biosecurity obligations. Otherwise, we won't achieve that free state that we want. Communication, I can't stress how important this is for me, probably more than anything else, to get communicating clearly and transparently so people have trust in what you're doing and understand why it's happening. That links into, therefore, having assurance and verification, having trained people in veterinary services capable of managing and dealing with issues, and oversight from a trustable, competent authority. And very importantly, it's a team effort. It involves everybody to take action and work together, that integration piece. And we're only, for me, as good as the weakest link in the system. Next slide, please. So thinking in some more specifics here within that biosecurity toolkit, I'm thinking particularly of prevention and preparation in terms of our HPAI outbreak. There were some key biosecurity weaknesses that we have identified. I'm confident from our robust epidemiological investigations of the infected premises we detected that they were all point introductions from the high level of wild bird infection that we were seeing. So there wasn't spread between farms. But what we did see was particularly around bedding and activities people do every day. So bedding kept wrapped outside, wrapped to protect it from the weather, to protect it from wild birds, then taken into or amongst the birds, the kept birds, with that wrapper on, and unwrapped in the shed with all the birds, enabling the spread of infected feces, virus-infected feces, amongst that shed. So something quite simple to think about, a relatively easy change in management practice, but wasn't forefront of people's minds. Another thing we found was really good biosecurity through trained personnel during the week, but often there would be temporary or revolving people on working over the weekend, and biosecurity didn't get that same attention to detail. And when you're facing that high wild bird background risk, 24/7 attention every time you go in to check your poultry, it's really important that you take effective measures. Otherwise, it doesn't take much virus, take them into a susceptible population and you have an outbreak starting. Vaccination and genetic resistance, again, something that we can do at individual farm level, building it into our management practices, but something also very important at the national level in building prevention approaches within our national populations, and the continued investment in research that I've mentioned. I think there's a lot more we can do, and I mean as in a UK sense, but probably globally as well, in providing people with the information to undertake more risk-based assessments for themselves in terms of their treating practices. Because although biosecurity can be generic, it's important that you're applying your measures to what your specific risks are for how you manage your animal population. But it comes together when you're looking at the national level in terms of improved traceability, for example. How do we know where animals have been moved from and to? Can we test them before they're moved into their new population to give us that assurance that there is disease freedom there? And then thinking of respond and control and recovering from disease outbreaks, I touched on our investigation of, is there a potential for vermin to be spreading coronavirus in sewers and things, but how do we deal with diseases when they are present in wildlife? And that's something, coming back to tuberculosis in the UK, is something we have been thinking heavily about, but it's appropriate, you know, to the rabies issue as well, and new and emerging diseases. When we have it in a wildlife population, which is not a kept or controlled population, what actions can we take to manage it? And clearly preventing it happening in the first place is absolutely where you get most benefit. Next slide, please. It's key for me in taking a systematic approach amongst all the actors. And in the UK, this was a finding from Dr. Anderson's reviews of our foot and mouth disease outbreaks in the 2000s, where he said that we should be looking to take a more systematic, consistent and regular approach to new and emerging threats. And so we developed the veterinary risk group cycle through a number of different tools for identifying changes in trends, changes in disease detections and so on. We feed them into our veterinary risk group where they are assessed through an ether tool. So this is a systematic assessment and weighing up of what is the potential impact and likelihood of this threat and what could be effective actions for it. It helps us direct resources, it helps us focus resource, and it also helps us to find this new threat might be really important. We need to think more about it. That information is considered by our experts and then fed out to policy owners, those people who can be in ownership of actions, and fed out to industry and livestock keepers as well through their vets to understand where they can take action. And importantly, in the red box there, we feed it to our HARES group. Our HARES group is a human and animal infections risk surveillance group, where we come together in an integrated way to consider potential new and emerging threats. Now, next slide, please.
Yeah, just 1 minute, please, Christine.
Thank you. And this is the same group, but it's just a demonstration with all those boxes. Don't look at the detail of just how many people are involved in feeding information into that cystic assessment. We try to capture everybody across the animal population systems to have a route to feed in. Next slide, please. And this highlights the HARES, which the Chief Medical Officer and I find hugely important, where we have regular systematic assessment of new and emerging threats that may have potential impact for humans. And it enables, when there's headlines around something emerging, enables us to have a risk and science-based evidence approach, an authoritative view on what's going on and how best to manage it. It is a really effective integration for me. Next slide, please. And we involve ministers. I send this up to ministers monthly to enable them to see the consistent where threats that we're constantly worrying about and new and emerging threats sit. It's a very complex slide. It's looking across the whole biosecurity spectrum, not just animal related threats, but it's important that ministers understand that constant changing picture and how to focus resource. Next slide, please. And just a demonstration does include our recent outbreaks of the need to be constantly prepared, to constantly invest in that insurance policy, because you never know when your next outbreak might emerge. Next slide, please. And in managing our disease outbreaks, so in the HPAI we recently had, again, the importance of really senior people being able to access information from the ground and be kept in that communication loop, so that they appreciate the ongoing need for sustainable funding, the systematic approach, and we're only as good as the weakest link. Thank you very much. I hope that's given you some food for thought, and look forward to your questions. Thank you.
Thank you very much, Christine, for that very detailed and interesting perspective of a really complicated matter. We've got some nice questions coming in. I just wanted to ask both of you, I'd be really interested to know, because you're both dealing with multiple agencies and ministries, and they've all got their own remits, whether it be human health, animal health, environmental health. How do you get people to work together? Is there legislation, or do you have some sort of central funding model? Or is it just that cooperation is expected through mutual understanding and trust? How does it actually work?
I'll go first if you don't mind. For us, it primarily is through that mutual understanding and shared interests and shared appreciation that the impact will be across across everybody. And so we need to work together, but it's people are so busy. Funding is, I guess, in many countries and certainly ours, held in pots and comes down from Treasury. That to give the basis for the ongoing interaction is difficult, and it's something I would like to see us at local, national and international level do more to achieve that integrated approach.
For us, antimicrobial resistance was a very good prompt. The Chief Veterinary Officer, as the Chief Veterinary Officer, I was invited in to meet with the Chief Medical Officers on the issue of AMR. They've been meeting for some time and kept saying, well, the problems with agriculture. And so the Chief Medical Officer at the time had previously been a veterinarian. So he said, well, I'll call the Chief Vet in, but you can't blame him. We have to work with him. And that built a very productive relationship. Our executive have asked for the type of advice that Christine is providing to her minister, and for that reason has co-located all of the chiefs together as an advisory group. So we've been forced to work together, and it's been very beneficial.
Thank you very much. Really useful to know. Right, we've got lots of questions, and I'm going to start off by taking some of the ones that you've been voted to the top of the poll. So our first question is from Rashid Mahmood, who says, in a country like Bangladesh, most of the small to medium scale farmers know about biosecurity, but they are very much reluctant to implement it in their farms. They think biosecurity investment is unnecessary, particularly for broiler chickens. How can One Health research, training and government support, motivate or force farmers to do the necessary investment in broiler farm biosecurity? So who would like to take that one first?
I'll go first. Really good question, and something that you'll never, I think, fully get on top of. It's constant and ongoing. For me, there is a lot about, so I talked about the importance of communication and sharing information. There's a lot about peer support and pressure and social behaviour, finding people within the livestock community that understand or have maybe experienced the impact of a biosecurity incursion. So, one of our farmers perhaps that's had HPAI, and then being willing to share their experiences with their colleagues and other farmers, and really hearing it from that perspective, because people can become deaf to the government messages, unsurprisingly. We feel, that they'll see us at quite a distance. What do you know about my daily life and how I'm going about my business? So it's really making it real and finding champions, I think, that is really helpful from my experience.
In Australia, we have a deed agreement, so a farmer will only be compensated if they've already demonstrated that they've taken the biosecurity measures to try and prevent infection. So in the event that we have an avian influenza incursion and we need to depopulate a property, that farmer will be compensated, but that compensation can be withheld if it's shown that the farmer didn't undertake necessary biosecurity precautions. So that's a mechanism that we use. But I think Robin would probably be best placed to talk about biosecurity in a southern perspective.
Okay, thank you both. I'm going to move to a question from Eric Fevre, who says biosecurity relates to all actors. Some of these will be outside the country and the kinds of surveillance and biosecurity, and the research to support, and the kinds of biosecurity and research to support that needed to prevent problems is an international issue. Can countries like the UK and Australia afford to be an island in this regard while reducing their engagement globally? So this is quite a topical question about our global engagement. Who would like to go first?
So we had our budget delivered last night, and that included a large raft of money to increase our offshore engagement. And part of that is to enhance our offshore screening and surveillance, so to get a better understanding of what's occurring in the region outside of Australia, and in a sense to try and put in place a buffer or an extended border so that we get forewarning or are able to prevent infected consignments coming to Australia earlier, rather than trying to deal with them once they've arrived in country. But certainly Australia as an island country is very much benefited from having that status in terms of our biosecurity. As we've seen during COVID, we're able to put every person that arrives in Australia into.
We've lost your voice, Mark.
Oh, you're still going. I'll pick up from there, Fiona. So for me, absolutely, working with other countries and investment is critical in this area. A good example I would use is the EU FMD model. So EU FMD runs under the FAO, and it's about providing money to the EU FMD experts who then work with countries that have disease or are at risk from having disease to support training, upskilling, veterinary services, better and quicker detection of disease and so on. And in doing that, supports their recovery in the economy, but also reduces the risk for those of us that may be round about them. I think that's been a really good model, and EU FMD actually are now looking at expanding into others, significant diseases from where there's global risk spread. So absolutely, I think constant engagement and investment in beyond your own borders, with the speed that people move nowadays, and the volume of people accepted not during the pandemic and lockdown, the risk pathways are always there. So we must think beyond our own borders.
Thank you. Mark, are you back online? Can we check?
Yes, sorry.
Oh, that's great.
Sorry about that.
So there is a related question, which I think you pretty much covered, from Marek Slomka, which was really about how now the UK could be said to be outside, yet still wishing to engage with Europe. What can the Australian experience teach us? But I think you've pretty much covered that. We might come back to it later if we need to. I'm going to move to a question from Clara Saville, who says the PVS evaluation is a comprehensive and informative tool for identifying gaps in national veterinary services. How can low and middle income countries be better supported to strengthen animal health systems to meet the standards that are outlined within the PVS pathway? Mark, would you like to go first for that one?
Sure. So funding from donors is necessary first to undertake the PVS evaluation, and then to implement the findings of those evaluations. So it's very important to pair up with donors. The Gates Foundation has been a great donor in this regard, as have a number of developed countries. Also, a number of countries are willing to share their experience and have a technical transfer of their experience and expertise in this regard. And I know Australia is one of those, and we're very keen to reach out in our region and to share our experience in terms of biosecurity and quarantine inspection with our neighbours.
For me, again, in the OIE space, I think the work and develop the work of the collaborating centres and also the kind of slightly reframing of the asks around those and the reference laboratories, it can be really effective in this space, where appointed centres reach out to other countries, other potential centres globally, to support them in developing testing expertise and so on, and thereby supporting veterinary services. So it's about hard cash and financial investment, but it's also about, really sharing and engaging on shared expertise and things, not just in a one-off, but that constant ongoing engagement. And for us, I think too, that integration back again with particularly health colleagues working globally, because it's so important, as we've been highlighting, that link humans and animals, but to people's livelihoods, and that we make that connection and do the work jointly when we're working with other countries, because I think the bang we get for our buck is much greater.
Thank you very much. Next question from Roger Harrison, who asks, to what extent do the agricultural departments in government have direct input and impact into the National Treasury and budget spending reviews and fiscal policy? Surely this is the biggest carrot and stick. So you both have the ears of government, so spill the beans, how does it work?
Well, up until recently, we've been very ineffective in that regard. We had a new senior manager come in and say to us that this is not working. I'm going to elevate the issue. So he asked for a briefing from me, and I said, well, we've got these exotic diseases that weren't in our region 3 years ago. Now they're on our doorstep, and I'm really worried about it. And he said, well, I'm worried about it now too, so come and tell the minister. We told the minister, and he said, I'm worried about that. I think you should come and tell the Prime Minister. So I briefed the Prime Minister, and we got $400 million in the budget last night. So if you can get an executive to take that initiative and carry your message, it can work. But my previous 10 years, I would have said it's impossible, but it is possible.
Okay, that's good. Christine.
I agree with the approach, though it's really complex and there are trade-offs at every stage. And for me, the biggest trade-off we always see is that kind of long-term insurance investment, if you like, in keeping exotic diseases out of your country versus other things that those same ministers want to do directly in the election cycle, and that persuasion that the insurance sustainable investment, you know, the value it demonstrates. And it's very difficult often to make the cost benefit analysis in a business case for something that you hope is never going to happen, and how they see it in the election and treasury cycles, the payback for that. So we've had, you know, we saw after foot and mouth disease 2001, really significant investment that was required. But we've been through global financial crash and things and various spending reviews that have reduced the input. Hopefully coronavirus and that ongoing assurance and horizon scanning need is well on Treasury's agenda now, and there'll be some continued investment for the moment. But it's really, really difficult as ministers change, elected politicians, governments change.
And a perhaps slightly related question from Halak Joshi, who asks, who leads in an outbreak when you need people from across all the different agencies? How is that decided?
So in the UK, we have a quite well-tested, established process now, following on from 2001. And we do a lot of training with other agencies and things about how it works. The lead from the National Control Centre is me. Because we're implementing established policy, generally not making new policy, working very closely with my policy colleagues. But we have a very integrated structure of bringing our devolved colleagues across the UK together. So we'll have daily meetings which involve health, they involve the local authority, they involve a food standards agency, amongst our battle rhythm, so that everybody is aware of the latest information, they know when they'll get it, and they know what their role of using it is. So that the investment in time in developing those coherent structures in peacetime, I cannot overemphasize how important it is.
Thank you. Mark.
Yes, so there's a National Consultative Committee. I chair that committee regardless of where the outbreak is occurring. The relevant state deals with the incursion on the ground. But if it was to be a very large-scale outbreak and involve other agencies, my role would be simply around the technical advice and support, and the logistics would be handled by other agencies.
Okay, thank you. Switching tack a little bit now, we've got a couple of questions here. One from Barbara Hessler, very interesting talk, she says, thank you. Do your risk assessment and management groups also look into how we can generate healthier ecosystems or systems that can prevent disease emergence in the first place? For example, management of original forests, land use, or regulation of livestock numbers. And I think linked to that is a question from Sophie von Dubschich, who says to Christine, many thanks for the slides. I'm curious about the reference for the statement 30% of new or emerging infection disease events arise as a result of land use changes. So maybe we can take those together and talk about what are we doing to make healthier ecosystems, and what about the land use?
It's a really excellent question from Barbara, a really excellent question, and something we, to be honest, have struggled with. So sometimes we hear about potential environmental threats, or wildlife threats, I think is a better way to say it. It's not the environment threat, it's become something in wildlife. And it comes into our veterinary risk group awareness, but we struggle to deal with it because we are primarily there to deal with kept animal populations, because the key reasons that government intervenes in disease in animals from our previous strategy is One Health aspects, trade aspects, economic and society impacts, and animal welfare. And wildlife, as people increasingly care about them, are becoming more integrated in that, but we've really struggled with it, partly because the expertise sits elsewhere. It's not something that our department has had a huge amount of expertise directly in. It sits in other agencies and universities and things, and we've not had a way to bring them into the system, and we're working on that. And also because there hasn't been a significant policy area around it to own and take forward the actions. That has been improving. I'm really impressed with the Australian biosecurity system, where you have that integrated, animals, plants, non-native invasive species, it all comes together in that systematic approach. And it's something in the UK we need to do more of. And on the reference, it came from one of our risk managers. I couldn't tell you off the top of my head precisely where she got it from, but she is well integrated into the One Health space, so I can go and find out.
Okay, great. And if you could send it to us, we'll put it up on the Slack channel. Great. Mark, any comment on Barbara's question?
Yeah, in Australia, nothing is imported without a formal risk assessment and a formal approval. And previously, that assessment only considered the impact on livestock and farm biosecurity. But recently has been expanded to include environmental biosecurity, so it's now a consideration where it wasn't previously. And I think that's a very healthy approach, but it is one that is quite slow in Australia. It takes a long time to undertake those formal assessments.
So, and can I just add then? So I talked about those 4 reasons for intervention under the previous strategy. So we are, like Australia, actively looking at now including impact on wildlife as a reason for us as vets and government to consider intervening. But a long way to go. We need to be better at it.
Okay, thank you. Okay, we're getting through the questions. There's still quite a few left, but we've got a few more minutes. So I'm going to go to a question from Joe Brownlee, which has just been jumped, never mind, from Joe, who asks, in a world with diminishing veterinary structural budgets, what are the issues that keep you awake at night with regard to control of infectious diseases? A quick answer if possible.
For me, it's investment and expertise. I am absolutely indebted to our epidemiologists because they give me the precise evidence and assurance and risk levels on which to make decisions. You cannot buy that expertise directly off a shelf. You just can't. You've got to invest sustainably in it. And as we discussed how budgets work, it's not easy to do that. That's what keeps me awake, not having them there when I really need them.
Okay, thank you.
For me, it's complacency. Australia has this self-belief in being clean and green and nothing serious happens here. And I think the outside environment has changed significantly in recent years, and we need to convey that message and be prepared and ready to respond.
Okay, thank you. So a question from Helen Scott Orr. Are there initiatives to train young vets, medical students and other discipline graduates together in a One Health mode to grow the collaborative mindset? We certainly have a One Health course at the Royal Vet College, joint with London School of Hygiene and Tropical Medicine at master's level. What about the more general landscape in this area?
There are conferences, and I'm aware of an undergraduate course offered at one university in Australia, but I don't think it was successful. The veterinarians were very keen on it, and the medical students not so much.
I think it's the perennial problem. Christine, any thoughts from the UK? How could we do it better?
Again, it's about that common message and understanding. So yes, we have, as you referenced, Fiona, a number of universities who run One Health courses, but they're vet schools and not so integrated with medical schools. But we have had success. A number of our vets that have worked as veterinary advisors with us have actually moved over into the public health field because of the similarities. And I think the insight they are able to deliver to our medical colleagues, and that, you know, as individuals, the integration and value add that they give is focusing thinking on that.
Okay, thank you. Question from Michael Francis, who says, do you feel it is important that veterinary and human medicine works closely together in tackling any future pandemic threats? I'm guessing you might say yes, but perhaps a little more expansion on that.
We've put in an enormous amount of effort since the start of last year when this pandemic emerged to encourage the WHO to investigate the origins and then to try and put in place resolutions that followed up that work to try and prevent future spillover events. And to that end, emphasising the need to have medical practitioners and veterinary practitioners working together. Indeed, when the WHO team was being put together, I spoke to them and said, well, you know, where are the vets? And they said, well, why would we need vets? I said, well, you know, this is a spillover event from animals. We're looking at wildlife wet markets. I think one or two vets wouldn't go astray. And it was great that they were able to accommodate that. But it was disappointing that you needed to have that discussion in the first place.
Sure.
So agree, absolutely there's space to do more. They are, after all, viral pandemics, although they may be in slightly different populations, humans versus animals, but there's a lot of common ground in there. The biggest pandemic we had prior to this in the UK was the foot and mouth disease in 2001. And it's not just about shared expert approaches and things. There's a lot of things in the whole fabric of responding in this infrastructure and things you need that are common. I would commend to people a paper by Keith Sumption, the Chief Veterinary Officer at FAO, that did some comparisons in response to the foot and mouth disease outbreak and coronavirus, just comparing, you know, some of the, you know, ability to trace, surveillance, early detection, so much commonality. We shouldn't be reinventing the wheel.
Okay, I'm going to try and take two more very, very quickly. One is from Techno Pouvoir 3, who says, in some countries like Nigeria, there is obviously no national biosecurity plan as a guide for farmers to follow. What are the initial steps you would advise to address this issue? Is there a system for doing this? Is there advice that can be given to people who don't have anything?
I think the initial steps are look to places where you think it is happening well, and what can you borrow for them, build a relationship with them, come back to not reinventing the wheel, OIE support, collaborating centres. There are a lot of common tools and people out there willing to share. So don't work on your own, look for support and mentoring and expertise.
Thank you, that sounds like good advice. Mark, anything to add?
No, I agree, and I think you'll find that there are many countries and experts willing to provide that support.
Okay, and then finally, I'm going to ask the question from Christina Osbjer, who says public-private partnerships are becoming more important in improving biosecurity, in particular in low and middle-income countries. Can you share any experience in collaborating with the private sector and success factors for such collaboration?
Oh gosh.
Maybe you don't, but if you do have any examples, that would be great.
So in Australia, we have a formal arrangement. So we established a company to provide that forum, Animal Health Australia, and it acts as a bridge between the livestock sectors and the government, and provides a forum that brings those together. and we together agree on what programs we want delivered, and we task AHA, Animal Health Australia, to carry those functions out, and we pay them to do that. And that's worked very well, both right down at the farm level, right up to the national level. So we've got a response plan for every emergent animal disease, and Animal Health Australia develops those and acts as the steward for those.
Okay, so thank you so much. This has been a really good and stimulating discussion, but we're now getting towards the end of our allotted time. So we're going to have to move on. And I'd like you all to join with me in thanking Mark and Christine for their really excellent presentations. And I'm just going to ask Dan to put up the key messages slide, which is just to highlight the crucial points that they raised. So the take-home messages: the immense and escalating challenges we face require comprehensive solutions. Biosecurity at the enterprise and national level is a key contributor to prosperity. Lasting change requires good governance. We're only all as good as the weakest link in the chain. A systematic approach is a must, or you'll miss warnings and threats. Sustainable resourcing: biosecurity is the insurance you can't afford to not invest in. So for you in the audience, we'd very much like your perspectives in our second poll, which I think is coming up now quickly. So please do see how you feel after the talk on what is the top level for implementing a One Health approach to tackle complex public health problems, including emerging zoonoses, food safety and AMR. Okay. Thanks again to our panellists, Christine Middlemiss and Mark Schipp, for the thought-provoking presentations. Thanks to our tech team who are working in the background to make everything run smoothly, and to our audience for fantastic participation and questions. Do please continue the discussions on our Slack channel if you want to log on and using the link you got at registration. I think we've got a slide to go up now about our next event, which is in 2 weeks' time, and this is on food systems, the shifting role of poultry in agriculture and diets. And our panelists are Dr. Hung Nguyen from ILRI and Bharati Kulkarni from the National Institute of Nutrition in India. So just finally, before we go, I think we might have got the results of the second poll. Yeah, so it's a slight reduction, but not too much, pretty much in the same ball game. Again, the priorities are to integrate all of the above. Okay, so with that, I wish you all a safe day or a safe evening, and thank you very much, everybody, for joining us. Thanks especially to the panelists again. It's been great.
You're welcome. Thank you very much.
Thanks a lot. Bye-bye.
Bye.